Well, good morning, everyone. It's 9 a.m. here in Anchorage, Alaska, and welcome to today's Alaska Collaborative on Health and the Environment webinar. This month's installment entitled Promoting a Culture of Health, the Role of Racial Equity in Healing Our Nation's Health Disparities. My name's Nick Reardon, and I'll be your host on behalf of Alaska Community Action on Toxics. I'm calling in from Anchorage, and these are the traditional lands of the Dena'ina people. So just want to take a moment to acknowledge that and thank the stewards of these lands and those of the many places that, you all call home. For those of you new to these gatherings, CHE Alaska, it's a regional partner of a national collaborative on health and the environment, abbreviated CHE, it's the CHE. And together, CHE and CHE Alaska, we're working to advance knowledge and action to address the concerns around links between human health and environmental factors. So you can check out more on that on our websites at akaction.org and healthandenvironment.org. Just a bit of housekeeping. This session will be more of an interview of a fireside chat format, a conversation with our guests. And so feel free to share questions or comments in the Q&A function here in Zoom. We're trying out the webinar add-on. So there's the chat box as well, and I'll try to pay attention to both, but there's only so many brains here. So the Q&A button would probably be the best place to put those questions. You can also raise your hand and I'll unmute your line if you want to ask things, but don't want to type them in. So now on to the reason we're all here today. We're absolutely honored to be joined by Dr. Gail Christopher to discuss her work on racial healing and health equity across our nation. Dr. Christopher, welcome. And thanks so much for joining us here today.
Well, Nick, it's my pleasure. I have to confess, I've never been to Alaska, but I am going to come and visit one day.
Well, you'd be most welcome. The full moon's on its way, and we're just starting to have daylight.
Okay.
But it's beautifully blue and purple outside. We'd welcome you. The day will come in the future. We were just before the call, talking a bit about how these issues are becoming, possibly more receptive to a new administration in Congress. And I, Dr. Christopher, I wanted to congratulate you and your team on what I believe this month is the 5th annual National Day of Racial Healing.
Yes, that's that. It was hard for me to imagine 5 years had passed, since we inaugurated that opportunity to set aside a day to focus in on both the need for and the actions that are happening. And hundreds of thousands of people around the country engage in that experience. And we wanted to continue to grow.
Yeah, well, I was excited to see it. And I think, the timing is great to have that in mid-January, especially this year. I'm realizing I just want to provide for folks not familiar with your work, or just to provide a better introduction for you. I feel like I've known you forever. Dr. Gail Christopher is the Executive Director of the National Collaborative for Health Equity and former Senior Advisor and Vice President to the W.K. Kellogg Foundation, where she worked for 10 years, perhaps over a decade, with a focus on children's health. You're currently on the board of the Children's Environmental Health Network, the chair of the board of the Trust for America's Health, and a fellow of the National Academy of Public Administration. Your expertise focuses on health policy, integrative health medicine, social determinants of health, and health inequities. There's half a dozen awards, or if not more, celebrating a lifetime of commitment and achievement on these issues. So I once again really appreciate you taking the time to talk with us today.
It's my pleasure and an honor, and thank you for that very gracious introduction, Nick.
Yeah, you're welcome. Yeah, can you provide us a little bit of an introduction about how racism is a public health crisis, how it's a human rights crisis? Kind of
Yeah,
set the
yeah.
scene here.
Sure, sure. And aren't we privileged to be able to acknowledge that over 150 jurisdictions in this country have declared racism to be a public health crisis? You know, I jokingly say there's some advantages to growing older, and none of them seem to be physical last time I checked, but you do have the advantage of seeing change happen in the country. And 20 years ago, even 10 years ago, that would not have happened. We wouldn't have this awareness in the public health institutional space that this idea of devaluing human beings, devaluing human lives, and that's what racism is. Racism is an idea that an idea that gives you permission to create structures and policies and practices that fundamentally devalue some lives and value others. And there's, you got to be clear about that. Racism is harmful. Racism creates health inequities. And so we are committed, have been committed. This has been the work of my entire career. I'll share a brief personal story. It really was the birth and death of my firstborn child that opened my eyes to the reality of what we term euphemistically as infant mortality. But it's one of those most persistent health inequities in terms of loss of life of both the mother potentially and the child in childbirth. And it embodies that particular manifestation of health inequity. It embodies in many ways the effects of the social determinants. In America, the social determinants, whether it's poverty or income, uh, exposure to toxins in the environment, um, the quality of the water that you drink, all of those things in this country are shaped by racism. They're shaped by where you live and how resources are distributed. And again, those are distributed based on who has the power to make those distributions and who are the people that they value or don't value.
Yeah, it's affects, as you're saying, it affects us on really personal levels. It affects policies. It really shapes the world around us and ourselves. Um, yeah, thanks for providing such a eloquent description of it. Uh, it's such a multifaceted issue. Here, here in Alaska, I know the racism and its effects on ourselves, individuals and policy. We're, I feel, maybe in a somewhat of a unique position in that, well, the history is both long-standing but also recent. Countries and nations that were conquered and with racist ideals then came here and we're living that out and only for some communities only 100 years ago.
Yep.
So yeah, it's fresh.
And it's the loss is universal. It's not just the people who experience the oppression of racism. We deny the potential, the expression of the full human potential of significant portions of our society. And in so doing, we deny ourselves access to tremendous talent and genius and capability. I don't think we can really fulfill the aspiration of democracy until we deal with this issue, of racial hierarchy and put it behind us. We are a diverse country. And right now, most of the children in America are children of color. So we just even have to be pragmatic and look at our self-interest and make a decision to create equal opportunity for all. But it's we're in a period of heightened division that is described as political division. But if you peel that back just a very, very little bit, just one layer, you see those divisions and those divides are a way to entrench the beliefs in racial hierarchy. So we have to be strong, I believe, as a country and be creative and call it what it is, tell the truth, and move forward together.
Yeah, I even see things like land acknowledgements at the start of this gathering and many others that I'm sure you and I attend, and many of our listeners. Seems like just one small step towards acknowledging that truth and trying to create a shared one.
Mhm. It's true. It's become a norm now in terms of the nonprofit world, and what we do is meet, right, and have conferences. So bringing in that reverence and that respect, for the indigenous people who were stewards of this land for millennia. I mean, it's crazy that this little brief period of history has become the period of dominance for one group. But Nick, it's important to understand that when you've had dominance or you have dominance, when you start imagining fairness and equity, for the people who have the dominance, it feels like oppression. It feels like they're not being treated fairly. And so that's why you have to move into this work from a place of wisdom, and if possible, from a place of compassion and understanding, because to those who have been at the top of the hierarchy in their minds and who've had the privilege, hegemony is a term that's used, this idea of balance and fairness, it doesn't feel fair to them. And so, that's part of what we mean by the healing work. It's finding our common sense of humanity and figuring out how to go forward together. But it's not through confrontation, actually.
Mm. Yeah, that's the fact that it's something that can be done on an individual level like that, I find very powerful. Doesn't require going and getting a degree necessary. This isn't a huge financial investment. It's an investment of time and intention.
Yeah,
I
I
think,
love that.
yeah.
Time and intention. Yeah.
I'm curious as well, based on sort of that idea of how, what role families play in that. Parents, friends, siblings, extended families, or
Well, our beliefs, our mindset, as it were, it begins in our immediate interactions with families. So our belief systems are shaped by the messages we receive, from our parents, from our teachers, from even the messages that the mother may be unconsciously transmitting to the child, in utero. This is, our brains are sponges. They're absorbing all this information, and we are forming our beliefs at a very early age. It's also the images that we see, and that's why, like, I have my first grandchild, and oh my goodness, what a joy. But I'm always sending books. Of course, he's supposed to read before he's 2, right? We're overdoing that, but I always send books that tell diverse stories, right? That show all kinds of people, so that he can grow up seeing himself as part of a broad, universal, global family of human beings, and identify in that way. So family has a role to play. Family also has a role to play in the changing of minds, because our minds can change. And if we're going to heal America, our minds are going to have to change, about each other. So bringing these skills into the house, the listening, the willingness to share, the willingness to question our assumptions. You're so right, Nick. This work happens in every home, and it happens in every community, every church, every city council. And that's how we gradually build up what I call the critical mass of goodwill and public sentiment for this.
Yeah, that makes sense. Yeah, the amazing things can be accomplished when the public will and the public interest is backing it.
Yeah.
So,
Abraham Lincoln said that was the requirement for change. And if we don't have the public sentiment, it's not going to happen.
yeah, yeah, yeah. You can make policies and erase policies all day long.
Yep.
Something that concerns me about the family issue is that there's sort of there's an interconnected nature to a relationship between the health of an individual and the health of a family, and the ability to create this critical mass if families are struggling and individuals are struggling. And yeah, could you talk a little bit about, I mean, this is just one example, but I feel like these issues are very interconnected in
And
that
they
way.
are. They are, and the COVID dilemma, the COVID debacle on many levels, the pandemic is making that really plain, right? As families have been hit so hard, both in terms of their actual health, but also their financial health and their financial viability. Our policy of a lack of affordable housing in this country has put so many people at risk of eviction, right? So there's that stress. That's one of the, if you look at the hierarchies of needs, that sense of insecurity because you don't have a place to be, to live, it's overwhelming, and it has a domino effect on a family. And we know this too well, and Indigenous people and people of color know it all too well. So when you have a family that's struggling to just survive, which is what's happening right now. I mean, food insecurity is outrageous in terms of the levels of just not having access to healthy food. And the food banks, they can't keep up with the demand, right? And the absurdity that we were actually cutting back on food distribution. And I was so pleased that one of the first executive orders of this administration was to be more generous in terms of food distribution in our country. There's no shortage of money. I mean, the rich have just gotten exponentially richer during this crisis and have been asked to pay less in taxes, right? So it really is kind of upside down, but I digress. To get back to your question about families, that's where it starts, our sense of security, our sense of safety. It's really wrapped up in our most immediate, intimate relationships. So being able to bring stability to families is so important right now. And I know that's the work of many nonprofit organizations, many churches, but we have to sort of step up our game and be able to reach out to one another and try to shore up the capacity for survival in the face of this pandemic. Now, it's not going to be with us forever, but while we're in it, I think it's very important to recognize neighbors and friends and households and families and do what we can to be helpful. I haven't been off my property since March, but I have learned who my neighbors are because they text me and they ring the doorbell and they say, is there anything I can bring you? Is there anything I can do? And I'm like, wow, this is okay. Thank you.
I really appreciate your point about connecting with your neighbors. You reminded me before the webinar started, we were talking a bit about the Andor project in Alaska, but it's reminding me of this idea of getting to know your neighbors and getting to know the place that you live, the history of the place, the current state of the place that you live, and the different communities that surround you. And I just wanted to take a moment and so about these workshops, these gatherings, the truth and racial healing and transformation efforts. And I mentioned the Andor project. That's just an example of this that has been going on in Alaska. But could you say a little more specifically about what those gatherings are?
Sure. Well, the Truth, Racial Healing and Transformation national effort is taking place in communities all over this country. And the notion is, just as you described it, Nick, it has a 5-part framework. The first part is narrative change, right? Telling the truth about history, about racism and how it drove colonization and conquering, and how that same set of beliefs about the devaluing of people drove decisions that were made about allocation of resources, respect or the lack of it for the environment and the culture that depended on the environment. So the first thing communities are doing are unearthing those stories that have been hidden and really telling the truth. It's grounded in a core belief in the goodness of people, because people hear these truths that they didn't know and they challenge the assumptions that they had. And honestly, you've seen people want to do better, want to create more fairness. So narrative change is a part of the framework, but then we do what we call actual racial healing. And those are various approaches to bringing people together. Now we're doing it virtually because you can't, come together in a circle in person these days and be safe. Because when you're in those circles, you are talking and you are sharing. And so masks won't necessarily be your protection. So for the time being, the circle experiences are largely virtual. Some people are doing them outside with enough space, but it's a challenge. So, but when you come together with people, you share your personal stories, which gives you a window into who you are as a human being. But the way it's designed, we really focus on our common humanity through the specific, right? So those gatherings are occurring. And all of that is to help build the critical mass, expand the circles of engagement for the real policy and transformation work. But in a democracy, you've got to have a majority if you're going to really sustain transformation. So you have to do the narrative work and the healing work, but then you look at the policies. Now, we asked ourselves, if racism is a lie, if this notion of valuing some people more than others, if it's not grounded in truth, how has it been sustained for all these centuries? And we came up with 3 primary pillars that help to sustain racial oppression. One is separation. And, if I can separate you from one another, if I can separate you from your family, if I can separate you from your ancestry and your land and all those things that make you whole, then I can maintain the fallacy of racial hierarchy. So we have to come up with ways to undo the built-in institutionalized separation, the cradle to prison pipeline, all of these things, the foster care system that devalues, all of these are ways of manifesting separation. The other piece of the framework is the legal system, whether it's the governance structure or the criminal justice system, the policing, all of that has within it the seeds of the belief in racial hierarchy. So you get an unequal and unfair distribution of punishment, an unequal allocation of resources, as we saw so vividly with the attack on the nation's capital, in terms of how these criminal acts were treated versus non-criminal acts of peaceful protest, when they were people of color. But there's so many nuances to the legal system that reflect this hierarchy. And then finally, I'll go back in terms of environment, the environmental decisions, where waste dumps are located, where toxins are allowed to flow into the water system. These are legal and policy decisions that are made, but once again, they've been driven in a contemporary and a historic sense by this persistent devaluation and permission to devalue people. And then finally, our economic system. I mean, it's amazing how if you sit and you look at the injustices, if you peel it back, you're going to find somebody's making money off that injustice. When President Biden said that the government will no longer contract with private prisons, now you see a stock market fall, right? Because so many people are making money off the prison industrial complex that uses as its fodder, if you will, people of color. Primarily. The majority of the people in the prisons in this country today are people of color. So that's just one example of how our economy is driven by the residual permission to devalue some people and value others more. So TRHT has all those components. All the communities around the country who are implementing it are doing that kind of work, recommending meaningful policy changes, but first building the critical mass that leads to that. And then every year, we celebrate a special day, National Day of Racial Healing, to help bring home the importance and the primacy of this work.
That's great. Thanks for that description and those examples. Is the National Day of Racial Healing, is it January 19th or is it?
It's always the day after the day we celebrate the Martin Luther King birthday.
Gotcha. Great.
And every 4 years, it's just before the inauguration of a new president. So we did that deliberately because we wanted to send a message to a new administration that this is a primary, important imperative. We also wanted to remind ourselves that Dr. King died so that the dream of equality could be realized. That was his life's work. It was a life of service, but somehow in making it a day of service, it's become a little disconnected from his imperative of overcoming racism, right? And so we felt putting this National Day of Racial Healing right after Dr. King's birthday, it would remind us of his legacy and help us to propel it forward.
Your comments about economies or the economy driving some of these issues. There's a question that came up here. How can we eliminate racism and discrimination in a capitalist society that values money? I mean, so is this possible? They ask.
Yeah, I get that question a lot. I'm not an economist by training, so I don't really know other forms of economy, you know. And I think that our capitalist economy is still an experiment. I think we could redesign this economy that with more emphasis on justice and fairness. And I think that's the opportunity that the pandemic has thrust upon us, right? You remember when we went into this, we could say that more people of color work in the service industry. And then all of a sudden, they became essential workers, right? Because all of a sudden, they're the ones who have to go to work if we're going to eat, right? They're the ones who have to drive the buses or the trains or whatever it is, if we can function. So if we can name them essential workers, we can pay them as if they were essential workers, And the wealth gap in this country is absurd. It is beyond absurd, So I think it's possible, but people have to be brought into that thinking. There was a report just last week, I think it was from Oxfam, that detailed the amount of wealth gained by the highest income brackets in this country during the pandemic. And the billions of dollars that these families and corporations have gained would be enough to wipe out poverty, in the United States. And so I think we have to shift our conversation to have the expectation that if they gave up everything they gained in the last year, they're not going to really lose anything, So we really have to have the expectation of designing approaches to distribution, if you will, of resources that are in all of our best interests.
Yeah, your description earlier, and with ACAT being Alaska Community Action on Toxics, this idea that if I go over to the fence between me and my neighbor's house and I'm dumping my trash over this fence. Well, I meet my neighbor. We learn how to relate to each other in a healthier way, and I stop doing that. On like an individual level, it's easier for me to appreciate how these connections can be formed. And then on a community level, I can start to imagine it. But Alaska and other Arctic communities, an issue we face is that toxic chemicals, they bioaccumulate, they concentrate here, and it's not our neighbors, it's not our communities who are necessarily polluting each other, but it comes from other nations. It's a global thing. And so you talk about a critical mass being reached. Some of these issues I see as maybe more tangible on like a smaller scale, and then other issues like the one I'm describing in terms of Arctic communities and concentrations of toxic chemicals. It seems like the critical mass to address this might be larger. Is that?
And we have suddenly awakened to the interconnection. It may be an Arctic community, but the Arctic mass of ice, the Arctic temperatures, the Arctic melting of what happens in the Arctic is affecting the oceans, and it's affecting all of us, And so being able to weave that thread of interconnection helps, this climate discussion under this administration is going to have primacy. There was a study just yesterday released, the largest global survey ever, 50 million plus people. And of them, 2/3 agreed that the climate change issues are an emergency crisis for the world to deal with, So being able to express the concerns of the Arctic communities within that framework that we all share some sort of a common, sense of belonging to and with, that's a step in the right direction. but it also requires organizations like yours, like the First Alaskan Institute, who have the advocacy, who have the voice, who have the experience and have the will to be part of these conversations and drive forward the change that we need to make. But you're absolutely right. And we just, we have to stay able to be advocates and to have our voices heard.
Yeah, I see connections as well with the National Collaborative on Health Equity. I mean, the food security and exposure, healthy living conditions rely upon and access to food in many Alaskan communities. These are determinants of health, and they're compromised by these issues too. So.
Yeah, we're very proud of the collaborative, and we work with organizations all over the country. And so, we believe that the real strength for change comes from the local communities coming together, identifying the problems, proposing solutions. And then we try to weave all that together in terms of our national work, advocacy work, and educational work. But ultimately, the social determinants of health get inside the human body, so to speak. They may be environmental in nature, but they get inside the human body, and they lead to compromise in terms of our immune capacities and our natural innate restorative capacities, whether it's toxins that we breathe in the air or the lead that's in the water, or the stress of being devalued as a human being due to discrimination. These things create biochemical and physiological changes in our bodies, which help to dampen down our innate restorative natural capabilities. But, there's the connection to nature we underestimate. And that's why I love my indigenous friends, my Alaskan friends, my Native American friends. There is Native American ancestry in my own background. But we know that nature is a healing force, right? That we are connected to the environment. The environment is us in so many ways. We have the same chemicals in our body that are in the earth. So learning how to honor that sacred relationship with nature is part of our evolution as a species. And it is part of the gift that comes from these diverse communities coming together, and learning to respect each other. Indigenous cultures have so much to teach us, right? So that's part of why there's an urgency for us to throw out this fallacy of racial hierarchy and learn to see and hear and listen and value each other.
You're here. I just wanted to take a second to invite folks to type in questions, I also, before I forget, you mentioned you're this larger the National Collaborative on Health Equity that you lead, and they're one of the branches of that organization that struck me as really powerful is the HOPE initiative.
Oh, yeah.
And that it's health and is it health and opportunity?
Yes, it's health, hope, health, opportunity, and equity. So the idea is that we frame the discussion around health disparities away from emphasizing the weak part of it or emphasizing the negative. We frame it in a positive opportunity frame. So this data tells a community, might tell Alaska, how many hundreds of thousands of people need to be moved to food security in order for Alaska to be a food secure place, right? So a policymaker could say, well, we have 53,000 people that are living in food insecurity based on all the data that's available. Surely we can deal with 53,000 people, and change the quality of their lives. So we do that around affordable income, equal income, affordable housing, transportation. We have 27 indicators that are really the social determinants framework, right? But we look at the data from multiple data sources, mostly federal sources actually, that have been validated. And we have compiled this sort of score for states. And we focus on states, Nick, because the policy decisions that drive quality of life in terms of where the money gets distributed, you know, how much the education system gets, the criminal justice system decisions, the development decisions, the transportation decisions, those are made at a state level. And, you know, sometimes it's federal money that's being distributed, but the state is critically important in terms of the resources for local communities. So we felt it would be important to have a state level way of viewing it so that legislators and policymakers could see that it is possible, you know, to move toward equity, and not just, you know, that phrase that people use, the poor will always be with us, you know, or that you hear the health disparities and you kind of begin to glaze over. You know, there's this idea that, oh, well, those problems are always going to be there. We wanted to shake that up a bit with the hope indicators and say, you know what, if you just did that, right? If you made sure that another 100,000 people or 200,000 people in your state had full coverage in terms of access to medical care, then that disparity goes away, you know. Or if you make sure that so many people, so many thousands of people are drinking healthy water, et cetera, you know. So that's the different frame, and it's catching on, you know. People are looking at it, and we're excited about it.
Yeah, I'd encourage all our listeners to have a look. There's links to the Hope Initiative on the announcement page on our website, and you can Google it too. But it's an incredible data set, and not only the information that it's bringing to the table, but the presentation, the interactive nature of it. It's very easy to compare to other states. It's very easy to, there's goals set and kind of explanations, summaries of the issues as well in text. So it's very easy to work with. And I think, like you said, for policymakers, it provides you with information, I think, as individuals and communities to take to policymakers and communicate with them.
Well, I'm so glad that you have a link to it on your website, and I hope you'll share it with the national network that you're a part of in terms of the Children's Environment, the Health Equity Network that you're part of, and environmental health too. Mm-hmm.
We've got a question going, just asking, see where Alaska stands on the Hope Initiative ratings of the state. I don't expect you to be an expert in that, Dr. Christopher, but
well, you know, I should have been. I should have checked out all that data before I did this.
I have played around on the website.
Okay, so you answer the question, Nick. How is Alaska doing?
You take a break. I'll field this one. I wonder, actually, even this is. Well, this may be a little bit complicated, but I can read it here. So on the Alaska page, it asks, you know, how does Alaska perform on health opportunity and equity? And it gives various rankings, but the summary statement for the state is that although Alaska experiences some of the best health outcomes, so, you know, infant mortality or birth weights, or just how people, you know, describe their health, excellent, good, you know, moderate, poor. The state experiences socioeconomic and environmental challenges, including education, livable income, and access to neighborhoods with low concentrations of poverty. And so, looking at the rankings, the lowest, we score well in health outcomes, kind of middle of the road with access to health care. But poorly on community and safety factors. So, you know, domestic abuse, assault, robbery, homicide, and physical environment is another one that Alaska struggles with. So, you know, quality of housing, access to affordable housing. And just one more point on this is that they also this data set also provides not just these sorts of rankings, but goals of how many people would it take, like you described, Dr. Christopher, and then to reach the goal set by this program or this initiative, and then a ranking on racial equity. So not just for the whole population of the state, but how do different ethnicities compare for these rankings. And I really think that nuance to it really focuses in on where there's really opportunity to improve and where issues lie.
And to, you know, to mobilize the advocacy groups within, you know, the state to say to your legislators, you know, to your leaders, look, this is how we're doing. We could do so much better. this is what it will take, you know. Now, the next iteration of the HOPE initiative for us to focus on would be the policy recommendations that must be put in place. We started this talk out talking about how many public health districts, jurisdictions, not even just public health, we've got city councils who are county leaders who've said that racism is a public health crisis, right? But what we have to do now is translate that declaration into specific actions and policies. And we think that the HOPE data can help to do that, can help people to say, okay, racism shows up in these ways in your state. Now, here's what you can do policy-wise to change that. Something as fundamental as what's taught in the school, you know, does the curriculum honor and respect the history of all the people in that community? Does it talk about the indigenous, you know, stewardship of the land and the people who were there first? And does it lift up the accomplishments? Does it tell the true story of the hierarchy and the domination and also the resistance to that? You know, does every child go to school and see themselves in the curriculum and see their ancestors in the curriculum? That's an important part of self-esteem. And self-esteem is an important part of agency, and agency is an important part of health, you know. But a local county or state can have a policy about that is part of the narrative change that we described. So there are many different ways that you might not imagine. Equity, pay equity is a big deal, right? Making sure that these essential workers have a livable wage so that they can support a family without having to work 4 jobs, you know, which takes away, I'm going back to our discussion about family, which takes away the security and the stability that's required, you know, within the home. So there are many things, but we just need to start having those kinds of conversations. And the data tool is just presented as a catalyst to help with that.
Yeah, that makes sense. I'm realizing I'm being a little remiss in attending to this Q&A section here. I'm hogging you, I think might be the term. But Eric Bissinger asks, so how do I identify racial injustices in my neighborhood? So maybe perhaps different than the state level. And some of these things seem difficult to identify. I can see illegal dumping, but can't see injustices in my daily life.
Well, that's where the listening comes in. And thank you, Eric, for that question. Because we created the racial healing circles so that people could learn to see and hear and listen to one another. We don't know about the injustices until someone tells us often, right? And so, they've got all these web online things called Nextdoor and Neighbor and et cetera. But you could invite some of your neighbors to be part of a conversation, and learn from each other as to what's really going on in your community that is equitable or inequitable, especially around issues of policing. That's one of the things that surfaces usually through conversation and lived experience. So I appreciate the question, but the immediate answers will come from the people in your neighborhood, the people that you might just not have a chance to interact with very often.
Yeah. Another question here. This is from Pam Miller here. And so what efforts are being made to educate students who are planning to become physicians and nurses about the need to address health disparities, racism, and a need for racial equity? Are there academic programs or medical degree programs?
Yeah, I would have to say not enough is being done, but after that, we do have a partnership with the Association of American Colleges and Universities, and their goal is to have TRHT campus centers on all the campuses across the country. Right now, I think there are about 40 campuses that are involved. A few of those are actually medical schools. And, periodically we listen to the reports of the leaders who are doing the work. And most recently, one of the leaders at Brown University was telling the story about the changes in the medical students' perceptions and understandings that was coming from the work. So I would have to say there's not enough that's happening. And of course, we know there's not even enough diversity, right? in the medical professions, we're still looking at single-digit percentage points of diversity within those professions usually. But still, the work is beginning. But see, it doesn't have to be episodic and piecemeal. We could have a national policy. We could put muscle and resources behind this. We could make this a requirement at the federal level, particularly for anybody that's getting, federal dollars to support either their institution or their experience. And we could make this kind of education and training a requirement. But that's part of the transformational work that is ahead of us. But it is happening episodically and sporadically.
Thanks. There's another question here. What advice do you have for discussing the pillars sustaining racial oppression with those who do not see it as a crisis? And that comes from Jennifer Oliver.
All right, Jennifer, that is an excellent question. And that's why the framework has the 5 components. And the first one is the narrative change, and the other one is the racial healing, because you do have to do some work to bring people into circle, to bring people into relationship, to bring people into awareness, so that you expand the numbers of folks who are aware, who do have an openness to see what they hadn't seen before. After the murder of George Floyd and the public protests globally and in this country, people's eyes were open to the racial inequity in our policing system. And I remember there was a corporate CEO that said that he learned more about the crisis of racism in our country within the 6 weeks after the death of George Floyd than he had learned in the 60 years of his lifetime, right? And so often this is a matter of lack of exposure and lack of understanding. And so I think that the narrative change part, the creating the understanding, and I'll say this very quickly. In my clinical practice years ago, my patients taught me about denial, right? And they taught me the levels of denial of facts, denial of consequences, denial of implications, but ultimately it's denial of feelings, because feelings frighten us. And so, but I did learn from them that people will move past denial when they feel like they have the support and the resources to face the problem. And so that's why the healing circle methodology, the bringing people together in a positive way, in an affirming way, it helps people to have the perception and the lived experience of being supported, not attacked, right, if this is done right, so that they can move past the denial that they've used all their lives, so they didn't have to face what one might call the ugly truths, So it's all done. It's not just the pillars, but it's a process that requires narrative change, requires racial healing. And then you select one of the pillars as a community. Usually Buffalo decided they were going to do all 5 pillars at the same time, but most people pick a pillar, and it might be about separation. It might be the economic, but I hope that's an answer to your question that's helpful.
Thanks, Dr. Christopher.
Mm-hmm.
There's another question that's come in. It's how can non-Black people of color best support the Black community while also uplifting their own communities? Beautiful
questions. Beautiful audience, actually. Well, it's interesting that you would say non-Black. I for years rebelled against the phrase non-white because, who wants to be defined by what they're not, right? But this work, as we suggest that it be done, it does include all people. And people who are not African American, who might be indigenous, who might be immigrant, who might be Asian American, Pacific Islander, Alaska Native, Hawaiian, Native Hawaiian, all of us are in this work together. And because the focus is on our common humanity, and it is on the belief system that devalues human beings, it gives us a way to all come to the table. Specifically, the way you can help your brothers and sisters of different races, like when they took the children away from the parents at the border, that was an outrage to any parent, to any human being. And we all needed to be mobilized to stand up for that. When George Floyd was killed, that was an affront to the humanity of every human being. So one of the ways that we can stand up for the perceived other, who is still my brother and sister, is to listen, to engage, and most often to ask them how I can be most helpful, you know. And sometimes I can be most helpful by listening. Sometimes I can be most helpful by forming an authentic relationship and being there in the crisis, standing with the other person. Sometimes I can be most helpful by being at a city council meeting or a school board meeting and speaking up for the rights, you know, of that group. But the first step is to learn as much as you can, listen as deeply as you can, and be in as an authentic a relationship as you can.
Karuna Jagger writes, "This is a wonderful conversation. Dr. Christopher's comments make me think of Dr. Loretta Ross's powerful writing on calling in. Thanks for the important discussion."
And what was the writing on? I missed that part, on calling.
Calling in quotes.
Okay, excellent. I'll have to look for that.
Yeah, me too.
Thank you.
There's a question here. Health proponents often struggle to address equity in programs and policy, leading sometimes to hard feelings between individuals and organizations who rightly feel their voices were not heard. There's positive change and predominantly white organizations shifting towards an equity focus. As we all work to build new bridges and alliances, can you suggest approaches to apply that racial healing to avoid having the burden of finding common ground continue to fall on groups representing communities of color?
Wow. Wow, that's an excellent question. And I didn't pay you to ask that question, but I have really, you know, and it's been decades, you know, I've been at this work for more years than I can count, but I have found that the bringing people together in circle so that there is trust, and it's a process, and you can visit our website or reach out, and we'll be happy to invite you to learn about the process in its detail. But we put a lot into trying to create the connective tissue for within groups that makes us all more aware and more capable of engaging from a place of affirmation, to build a sense of belonging, and to have the consciousness shift that's required for more authentic progress together, and we work with national organizations, we work with local organizations, because we all have to unpack. We all have to unpack the biases that we have grown up with and the privilege that we have grown comfortable with, which is really hard. The first time anyone accused me of being a person of privilege was at an international meeting in Switzerland. And there were people from all over the world, people from Africa and Asia, and they realized I was from America. And immediately I was the American with privilege, and it was very humbling for me, because I was like, well, wait a minute, I'm a person of color in America, I'm not. But I had to recognize that we all project and are burdened by projections of who we are, right? And so I was humbled in that moment, and I realized that we all have to figure out how to build relationships that allow us to work together despite our perceived roles and differences. Misogyny and patriarchy are ones that I have a lot of trouble with still, because, it's still there, and you can be, and in my circles, I'm often in rooms where I'm the only woman. And so often, I'll say something and nobody pays any attention. And then some man will say exactly what I said, and they'll say, well, John had a wonderful idea, and there I am, devalued and having to carry this burden until I learned to speak up. And one of those meetings, I spoke up and I said, is there an echo in this room, or did I not just say that? So you could see everybody turned colors, and they were like, oh my God, But sometimes, it requires us to assert. But if you have the affirmation, the confidence in yourself as a person of color, you're more likely to do that. But the short answer to your question is, you got to do the relational work within the group and begin to build trust. And it works. People do walk out of those circles and sessions if they're facilitated, and they're always co-facilitated. If they're facilitated in a way that invites that kind of honesty and authenticity that's required for us to do this work together.
And that question was from Margaret Shield. I forgot to put the name.
Thank you, Margaret. It was a great question.
The Sama Seganat Medina is sharing a link to healthyalaskans.org data and a scorecard. And they say that these Healthy Alaskans scorecards show the trends for each of the health objectives over the decade.
Great.
Yeah.
Great. So you can connect the dots there. That would be wonderful. Yeah. Healthyalaskans.org. Okay.
Yeah. Yeah, I'll share that. Any additional resources or things that pop up in our conversation, I'll add them to the resource list and send them out along with the follow-up email. I'm just looking at the hour. Where does the time go?
Well, it is almost over, isn't it? Wow. But it did go the way you planned it, in terms of the presentation and then the Q&A. So this is good.
What am I missing? I don't know what I don't know. Is there any final words or last comments that?
Well, I am right now trying to get our national leadership, the new administration, to understand that the healing work is as important as the equity work, that we have to build a critical mass of public will. And we don't do that by mandate, we don't do that by dictate. We have to do that by supporting and resourcing communities who are willing to do the work of coming together. And so one of the things I encourage anybody that's listening to this is to ask your leaders, Senator Murkowski and others, to get to the president and to say, you know what, we got to do some healing work in this country. We really have to come together. And based on the inherent goodness that's in most of us, sometimes it's been overshadowed in some of us, but we've got to tap into that and do the work on the ground of expanding our circles of engagement for equity. And that's missing right now from the platform. And so to the degree that you all can help ask for that, I think it will help us to move in the right direction.
Building that critical mass.
Absolutely. Yeah. Public sentiment, in Abraham Lincoln's words. Yeah.
Well, thanks so much, Dr. Christopher, for joining us and sharing your time with us. It is so greatly appreciated.
It's been my pleasure. I feel like I've been in Alaska for a minute. And so thank you very much for the invitation. And we will stay in touch and stay connected. And please invite people to visit our webpage. And good luck to you. Stay healthy and stay safe.
Yeah, you too.
Take care.
I'll send out an email to everyone within the next day or two with a link to other resources and just an update that our next conversation will be the last Wednesday in February, when we'll be joined with Dr. Libarn from, I believe from Nova Scotia, but for a discussion on anti-colonial science. And so she has pioneering work on or just some quite creative methods for making environmental sampling more accessible to communities, as well as a new book on pollution as a form of colonialism or colonization.
And that's the name of the book? Okay, good. I am going to get that book. All right.
Yeah, I think it's coming out in April, but yeah, it's on the way. And so, yeah, and if anyone can, please donate to support these monthly Che Alaska calls and ACAT's other efforts. You can give at our website, www.akaction.org. And any additional questions or comments, please don't hesitate to reach out to us at 907-222-7714. Thanks again, everyone. And yeah, thanks so much, Dr. Christopher.
You're welcome. Bye-bye.
Bye.